Hey all. So, the Human Rights Agreement explanation video. I want to start by saying I filed this complaint based on the fact that I was in the hospital in Halifax, Nova Scotia. I was undergoing a medically necessary hysterectomy and bilateral oophorectomy, total hysterectomy, and the next morning following the procedure I was asked to leave the hospital in no kind terms. Anyways, I filed a human rights complaint under the basis of sex/gender, and it was because of this complaint that they ended up, the House of Legislature really took notice of the fact that there wasn't even a place in the Human Rights Act that this fell under completely. So the Human Rights Act was amended into 2012. Here nor there. So what I found interesting, or what I think is great, I'm really happy with this agreement. It could have been worse. It could have been a whole lot quicker for what it is. So it's myself, Nova Scotia Medical Service Insurance Plan, also known as MSI, and they're represented by the Department of Health and Wellness, also known as DHW, and the Nova Scotia Human Rights Commission. So that's the parties involved. So the Department of Health and Wellness last year, and I guess it would have been the summer before that, they announced they were going to change the physician's manual, and a year ago in April they did change the physician's manual to remove the exemption for sex reassignment surgery, so there is funding for that now because of that particular document change. So that's a step taken by the Department of Health and Wellness since this resolution has begun. They have committed to, where'd it go? Oh yeah, they've committed to continuing to collaborate with key stakeholders in order to prevent marginalization by the healthcare system and reduce further negative outcomes for members of the trans community. So it's written and stated clearly that they expect primary healthcare providers throughout Nova Scotia to deliver primary healthcare respectfully and responsive to cultural health beliefs, practices, and lived experiences. So trans people fall under lived experiences, and they're acknowledging that it's important that all primary healthcare providers are respectful of that. So that's important. And they've also, the Department of Health and Wellness is also committed to continuing to fund cultural competency, which they do fund now, but they're making a pronounced effort to include gender issues. The Department of Health and Wellness acknowledges the need for safe and accessible primary healthcare services. Yeah, we've talked about that. What I'm particularly proud of is they're actually going to review its contract of service with Medivie Blue Cross to ensure that through their offices and services that is also being respected and properly reflected. So they're going to do that by June 1st of this year. The Department of Health and Wellness paid my bill for the surgery because I was not going to. It was, even out of principle, I could have had the cash in my pocket and I wouldn't have paid for it. So they had done that. They made a small contribution to my legal fee, like I mentioned in my last video, and they gave me, after much hassling, a written apology, which I might add my lawyer had to write and then have them sign. So I don't think that counts, but whatever. So, anyways, throughout all this, the Human Rights Commission and the people that I worked with from the commission itself, they learned a lot about the language, the experience, the stigmas that we have around gender. They learned a whole lot over the last 4 years, and we actually have an agreement that leaves out, like, just between me and them, and it just reiterates their commitment to continuing to educate themselves, and then by extension through the Human Rights Commission. They're going to request a meeting with the Special Advisor to the Associate Deputy Minister on Diversity and Social Inclusion. Not entirely sure who that is at the moment. But the point is, they're going to continue to monitor this issue, for lack of a better word. Also, Pride Health, Sibel Reber, she's great at Pride Health in Halifax. Pride Health is going to engage in discussions with the Human Rights Commission and, like, keep them in the loop as far as trans healthcare. And then the Human Rights Commission is going to develop and offer a panel, like a trans medical sort of panel for doctors, and that's going to be for all members of Doctors Nova Scotia. And currently there's no mandate for doctors to treat anyone that they basically don't want to treat in Nova Scotia. So it's really important that they'll have access to that. You never know, it might be mandated. I guess we'll see when it happens in the future. The other part of this thing is, there's no admission of liability, or, they didn't say that they've done anything wrong. They just apologized for my hurt feelings and yada yada. So, and I can't sue them civilly or anything like that. But, and actually, I'll probably scan the letter of apology and put it on my blog, and I'll put a link below in the description of this video. So if you want to read that too, you can check that out. And yeah, see, I mean, after 4 years, I expected something like that we could celebrate, but it's really not that exciting. So, anticlimactic, yes, but all in all, I'm good, I'm happy that it's over, and now I can move on and do other things. Hopefully. Someday. Soon. But, till then, I'll see you guys on Wednesday.